Hi, my name is Cassandra and I'm a kinesiologist. Today I'm going to be teaching you some exercises that are beginner level friendly for people with knee osteoarthritis and who want to get stronger. Let's get started with a warm-up. You'll need your body and a wall. We're going to begin with some calf raises. So put your hand on the wall if you need support, and we're going to start with 5 calf raises. Both legs going up onto your toes. 3, 4, and 5. You're now going to put your back up against the wall. Lean a little bit back, place your weight on your heels, and then you're going to lift both your toes at the same time. 5 as well. You're going to keep your back up against the wall, keeping your back neutral, and then with feet about hip width apart, you're going to slide down the wall in a quarter squat. So you're not going to go as far as 90-degree bend of your knee, but just a little bit, just until your toes disappear behind your knees. So if you're looking down, just about that much bend. 4 and 5. Next, we're going to be doing a hip hinge. You're still going to need the wall here. You're going to be about half a foot away from the wall, and you're going to imagine bending at the axis point right at your hips, keeping your legs fairly straight. You're going to keep a neutral spine here, and you're going to tap slightly back towards the wall. And you're going to do 5 here. 3, 4, and 5. Great. The last exercise, you're going to be doing a toe tap, just to get some weight on one leg versus the other. So, hand on the wall if you need support, and you're going to take one leg out to the side, and you're just going to tap to the side leg. So, 3, 4, and 5. And now you're going to do the other side. Transfer your weight. 1, 2, 3, 4, and 5. Great. So for the next part, you're going to need a mat, a band, and a ball or pillow. You're going to start lying on your back, placing this equipment off to the side. And you're going to be doing 10 bridges. So a bridge involves bringing the belly button towards the spine, squeezing the glutes, and lifting your hips up towards the ceiling so that they're in line with the knee and the shoulder. You're going to go up and down, and we're going to do this for 45 seconds. Now all the work needs to stay right in the glutes and the hamstrings. If you're feeling it in your lower back, make sure that you go a little bit lower. And for all of these exercises, make sure that they're pain-free. Once you've completed about 45 seconds, you're going to rest for about 15 seconds on your back. And you're going to move towards the second exercise, where you're going to be using your hands to press onto each of your knees. You'll put both hands on top of each other, push them against the knee, and you're going to hold for 5 seconds. Switching to the other side, you're going to create equal and opposite pressure with your hands against your knees pulling up towards your chest. And for this type of exercise, you get to choose how much intensity you want to put into the exercise. Again, keeping this pain-free. So alternate pressing on your knees for about 45 seconds. Once you've completed that, rest for 15 seconds. You can take that rest time to grab your ball. You're going to stay lying down on your back, and the ball is going to go in between the legs here. Legs stay about hip width apart. Now, just like the holds that you were doing with your hands or your knees, you're going to be squeezing the ball or pillow in between your legs. You're going to squeeze, hold for about 3 to 5 seconds, and relax. Again, with this type of exercise, you're just going to go as intense as you feel comfortable, and you get to choose how much resistance you're making for yourself. Again, you're going to be doing about 45 seconds. This ends up being about 12 to 15 reps. Once you've completed the 45 seconds, you're going to rest, switch the ball out for the band, and the band is going to go right around the legs. Here, just above the knees. Lying back on your back, you're going to open up the legs against the resistance of the bands. Coming back nice and slow. You want to make sure that your knees are coming back in a really nice, smooth pattern, going in and out, and not having your knees jump back when you come together. Just like the previous exercises, you're going to do about 45 seconds of this. And once you finish the 45 seconds, you're going to be all done with these exercises. Next, you're going to remove the band from your knees, and you're going to sit up. So using your ball or your pillow, you're going to prop it underneath your thigh here. Not too far that it's right underneath the knee joint, just a little bit up. The other leg can be relaxed. And what you're going to do is just lift your heel off of the floor with that prop underneath your thigh. So how it looks is just like this. And what you're going to do is 10 reps of this. So straightening and bending the knee. Once you've completed 10 reps, you're going to move the ball or pillow underneath the other leg, and you're going to do the other side. So that other leg is now straight. And you're going to be straightening out here. Now the main mover for this exercise is your quad. So make sure to squeeze the quad or the top of the thigh right when you stretch out your leg. And if you're having any discomfort with this exercise, make sure to make a smaller range. So don't go all the way straight out like this, but just half to lift your heel off the ground. Great. Okay, now let's get ready to cool down. The benefit of the cool down is to let our muscles to relax after exercise and to return our body to a normal state. So you're gonna need a band like this that's a bit heavier, or a belt works as well, something firm. You're gonna be starting by stretching the muscles of your calf right back here. You're gonna put the band around the forefoot here, and you're going to tension the band pulling towards you, bringing your toes towards you, getting a nice stretch in the lower leg. Okay? You're going to do this for about 30 seconds. Relax your arms, and then bend your knee a little bit and do the exact same motion. So here we're stretching a slightly different muscle. Again, holding for about 30 seconds, keeping the tension there, feeling a good stretch to mild discomfort at the back of your leg. If you're finding it's painful, just release your foot, release the tension a little bit. Once you've done that on both sides, you're still going to use the belt or band, and you're going to have that help you, assist you to bend your knee back and forth. So you're going to bring your knee up towards you, using your arms to go back and forth. Now, if you do this with a sock on a smooth surface, you'll glide a little bit better than wearing shoes. You're going to do this about 10 to 15 times as comfortable before switching to the other side. Great work! You're all done with these exercises. I would recommend doing these exercises at least once daily for best results. If they're starting to get a little bit easy, just increase the reps or the depth, like bending your knee a little bit further, or it may be time to progress to the next level. Keep up the good work.